everyone, to the California Immunization Coalition Education Hour. I'm Catherine Martin, Director for the Coalition, and our coalition hosts these education hours throughout the year on important subjects and topics related to immunization to help you, our colleagues in public health and schools, and our public health community stay up to date on news and information on immunizations and vaccine-preventable diseases. So today's call is part 2 of a webinar on the new school rules, and we're discussing the implementation of Senate Bill 277, which is now law. By the end of this call, participants should be able to describe the rationale and purpose of this legislation, address common questions about the new law, and especially understand the role of school nurses and other school personnel in explaining and enforcing the new law, and knowing where you can go for additional resources to assist in educating and supporting your school community. And now I'm going to give a very brief overview of SB 277 and what we feel is going to be one of a pretty big impact on school nurses, at least through next year and the year afterwards, as we get used to this new way of helping our families make sure their children and our school communities are protected. You're all very familiar with what happened last year. At the end of December and the beginning of January with the measles outbreak, started at the Disneyland theme parks and generated a large number of cases and a lot of work for our public health communities and a lot of concern and discomfort for the families that were impacted and for the communities that were and schools were impacted. This generated a strong interest among the media and among legislators in California and beyond about what we need to do to improve our vaccination rates and improve the use of the personal belief exemption to be able to limit that, because it, in our view and in the view of many legislators, had reached a point where we needed to take action. Senate Bill 277 was introduced by Senators Richard Pan, M.D., and Ben Allen from Los Angeles area. And here you see some of the wonderful supporters and sponsors of this bill, particularly Vaccinate California and CMA health officers and the American Academy of Pediatrics, along with others. Tremendous support. We won't go into the detail of how many and who all was involved, but let's just say it was a total team effort and involved a lot of fantastic folks, including the California School Nurses Organization right here. The very quick review of this is that it would remove the personal belief exemption from school vaccine requirements and only allow exemptions for medical reasons. And Dr. Schechter, who I'm going to introduce in a few moments, is going to go through who this applies to and how it impacts our school communities. As you also know, the bill was signed into law pretty quickly by our governor on June 30th, 2015. And there's been various actions taken by the opposition to this bill, including a referendum to repeal SB 277, which gathered signatures but did not meet the goal of the signatures that they needed to submit it for a ballot measure. And then another group related to the opposition also submitted a request to the Attorney General's office to have a change to the Constitution about parental rights and responsibilities, and that was withdrawn by that community in October. And so what remains is a recall effort against the senator who worked very hard. Now I'm going to introduce Dr. Rob Schechter. Dr. Schechter is the chief of the Clinical and Policy Section for the CDPH Immunization Branch, and he's been a medical officer with the California Department of Public Health since 2003. He's worked with the Advisory Committee on Immunization Practices on various committees, and he's also a member of the American Academy of Pediatrics. Dr. Schechter is involved in many important CDPH immunization initiatives, including seasonal and pandemic influenza, pertussis, and other emerging vaccine issues. And we really appreciate all his time today on preparing the slides and this presentation for today. So I'll hand it over to you, Dr. Schechter.
Thanks, Catherine. It's an honor to be Catherine's voice for a few minutes and now to be back to talk about my slides. Over the next few minutes, I would like to provide a brief introduction about the law, otherwise known as Senate Bill or SB 277, for you at schools in California. In these next few minutes, I'd like to review existing long-standing school immunization requirements and then see how this new law fits in, what's the same and what's different under the new law. In my talk today, I'm going to refer to frequently asked questions and answers which are posted at www.shotsforschool.org. It's one section of the Shots for School website, which you may be familiar with. There's a variety of resources related to the law, primarily the frequently asked questions, but also access to the language of the law itself and other school immunization laws, and a variety of general resources for schools, medical providers, parents, and other interested parties. Between the website and my talk today, I hope I'll be able to answer many of your questions, but I imagine that you may still have some issues that are not resolved. This Shots for School site has a lot of information but may not be able to answer all of your questions. And for that reason, I would encourage you to identify the legal and policy staff within your local education agency, whether that's your school or school district or the County Office of Education, that can help you along the way. The website will be updated, has been updated over the last months and will continue to be so. So you can continue to check back there to see if there's updates on issues of concern. So let me go into a brief outline of what immunization laws contain prior to 2016 and the arrival of SB 277. As Catherine indicated, state immunization law applies broadly to elementary schools, secondary schools, and a variety of pre-kindergarten settings, child care centers, day nurseries, nursery schools, etc. Whether those are public facilities or whether they're private facilities, they're all covered under state immunization law. As you'll be very familiar with, there are some standard checkpoints for immunization requirements, including when children start child care. Now, if they're young enough, young infants and toddlers in child care have changing requirements, either additional doses or some additional vaccines as they age in child care up to the age of 18 months. And from about 18 months until the end of child care, those requirements are the same. At the time of entry into kindergarten or transitional kindergarten is another major checkpoint, as is entry or advancement into 7th grade. For a smaller proportion of kids, if you have children coming into your school or child care from outside of California into California, then there's a check of requirements at any grade level. Now, as you'll also be probably very familiar with, there's documentation required from each child. The state law requires documentary proof of each entrant's immunization status. This is typically arrives through the yellow card or a similar paper record that starts out in a provider's office and then transmitted to the school through the parent, or increasingly that information's stored on the California Immunization Registry so schools can have direct access. The law also states that the record has to be entered into the child's cumulative file or similar permanent enrollment and scholarship record. This slide has a table of the entry requirements for kindergarten or transitional kindergarten. This information is available different places on the Shots for School website, and it indicates that for a child coming into TK or K, they need up to 4 doses of polio vaccine, up to 5 doses of diphtheria, tetanus, or pertussis vaccine, 2 doses on or after the first birthday of a measles-containing vaccine, which in the United States means MMR, combination vaccine, up to 3 doses of hepatitis B vaccine, and 1 or more doses of the chickenpox or varicella vaccine. Now, state law, the statute and regulations describe various ways to meet the immunization requirements. Some of these are under the category of unconditional admission, and some of these are under the category of conditional admission. For unconditional admission, there needs to be documentation for each required dose of either receipt of the vaccine from the yellow card or registry or similar source, or of a permanent medical exemption issued by a licensed physician, or a personal belief exemption. Talking about current law, personal belief exemption is one way to meet unconditional admission. Now, as I'll talk about in a second, this is a major area changed by Senate Bill 277. There are also categories for conditional admission. For each dose that does not meet a requirement for unconditional admission, there needs to be documentation either of temporary medical exemption, again from a licensed physician, or that documentation that the child is eligible for the conditional admission schedule. Now, not all children who are behind on their shots are going to be eligible for the conditional admission schedule. In order to be eligible, a child has to have received all doses due at the moment, at the time of enrollment, of entering school. But because of the intervals between doses for multiple dose schedules, there are additional required doses that are due later in the year. So to be eligible, each child has to have at least one dose of each required vaccine and may need additional doses depending on when prior doses were given. As an example of this, here is an excerpt from the conditional admission immunization schedule. The full schedule is linked on the Shots for School website, or you can reach it through the URL at the bottom of the slide. And this shows polio vaccine and how, again, at least one dose is required before admission, and if enough time has passed since that first dose, additional doses may be needed as well. The state immunization law describes some situations in which children are excluded from school. If there's a child that has not met one or more requirements for unconditional or conditional admission, the child should not be admitted. If a child has been admitted under conditional admission, but then later fails to meet a requirements deadline, the child should be excluded until the requirement is met. And lastly, there are children who are unimmunized in various categories, including medical exemptions, and those children may be excluded from school or child care when they have been exposed to the disease in question. So after going through these categories, I want to strongly emphasize that most children in California meet the immunized category, are unconditionally admitted. They've gotten all their required immunizations. And because of that, they're not going to be affected by SB 277. This graph of Department of Public Health data shows that for children entering kindergarten in 2014-15, at least 90% of those children were reported to have completed their series for each dose, each vaccine. And in contrast to these 90% plus figures, again, who are not affected by the new law, the SB 277, this is a slide which shows the trend, the percentage each year in kindergarten entrants with personal belief exemptions, or PBEs, to one or more required vaccines from the late 1970s through the last year for which we have data, which was the 14-15 school year. And the trend shows that in past decades, it's up through the mid to late 1990s, that rate was around the 0.5% level, maybe slightly higher some years. And then starting in the mid to late 1990s, that rate increased substantially to current levels of 2.5% to 3%. Within these annual averages, there's a wide variation in what's going on at any individual school, as you'll be fully aware. There are many schools in California that do not have any children with personal belief exemptions, or only a few. And at the other end of the spectrum, there are schools whose percentage or proportion of children with personal belief exemptions far exceeds the 2 to 3% level and could be much, much higher. So in thinking about, as we go ahead and talk about SB 277, these are the children and their families in future entering classes who are going to be affected by the law. This somewhere up to 3% of families and children, as opposed to the 90+% of families who comply with the immunization requirements through immunizations or other categories. So, and though those personal belief exemption proportion is pretty small, in the range of 0.5% to 3%, they have a disproportionate effect, a major effect in catching vaccine-preventable diseases and potentially transmitting them to other vulnerable people. And as one example of this, can look back a year ago. It was almost a year ago when the Disneyland outbreak started in late December of 2014. And of the first 110 cases in California who caught the measles during the outbreak, at least a quarter of them had been intentionally not vaccinated against measles during childhood. Most of these were still children. The decision not to immunize was pretty recent, and at a time when the personal belief exemption rate was higher, maybe up to 2 to 3%. But then some of these cases, the decision not to immunize had been made in past decades when the exemption rate was much lower, closer to 0.5%. So despite these low numbers, again, somewhere between 0.5% and 2 to 3%, depending on the year, these individuals represented at least a quarter of those who caught measles in the outbreak and also transmitted it, including to infants too young to be immunized, which were another roughly 10% of at least these first 110 cases. So it is in this context that in the first half of the year, the legislature passed, and by the end of June, the governor signed Senate Bill 277. The language of the law, again, is linked to the Shots for School website, and this is a screenshot of the state legislative site in which it appears. And starting next year, some of the major provisions of the bill is that there will be no new personal belief exemptions for current immunization requirements for children entering child care or schools. Another provision is sometimes referred to as a grandfather clause or grandfathered PBEs, in which specific exemptions, specific personal belief exemptions for current pupils that were submitted before 2016 remain valid within specified grade spans in the law. For children who entered child care prior to 2016 with a personal belief exemption, or where the exemption was filed by 2016, the exemption will remain valid until the child starts transitional kindergarten or kindergarten. And for children who are somewhere in the span between transitional kindergarten and 6th grade and entered with a personal belief exemption, that will remain valid until they enter or advance to 7th grade. So I'm now going to switch to some of these frequently asked questions related to the personal belief exemption. First question, will personal belief exemptions filed during or after 2016 be valid? No. Starting in 2016, personal belief exemptions will no longer be an option for the vaccines that are currently required for entry into school or child care in California. Under 277, are religious beliefs distinguished from other personal beliefs? No distinction is made between exemptions based on religious beliefs and other personal beliefs. Starting in 2016, exemptions for religious and other personal beliefs will no longer be an option for the vaccines that are currently required for entry into school or child care in California. Will personal belief exemptions, including those based on religious beliefs, filed in California before 2016 remain valid in later years? A personal belief exemption filed before January 1st, 2016 at a child care facility will remain valid until the child first enters the span between transitional kindergarten through 6th grade. I think we had a question about whether if a child skips kindergarten and goes right into 1st grade, and that would be the start of the span, and the prior exemption would be no longer valid. If the PBE was filed at entry into any grade from transitional kindergarten or kindergarten through 6th grade, that exemption would remain valid until the child completes 6th grade. And if there was an exemption filed previously to 2016 at entry to any grade from 7th to 12th, that will remain valid through 12th grade. So related to this question is that exemptions, personal belief exemptions filed in 2015 are only valid when signed no more than 6 months prior to first entry, signed and filed no more than 6 months prior to first entry into school of child care or a new grade span. Therefore, PBEs filed in 2015 are invalid for children first entering child or school in the fall of 2016, because the typical school year will be starting in August or September. That's longer than 6 months, the 6-month maximum period, in the current PBE law for completing the PBE form, for signing off on the PBE form. My child was admitted to Transitional Kindergarten in 2015 with a valid personal belief exemption to one of the required vaccines. How long may her exemption remain valid? A personal beliefs exemption filed in 2015 at entry into Transitional Kindergarten may remain valid until the completion of 6th grade. Is a personal beliefs exemption still valid if a child transfers between child care facilities in California after 2015? Yes. A personal beliefs exemption filed with a child care facility before January 1st, 2016 is valid until entry into the next grade span, meaning transitional kindergarten through 6th grade. Personal beliefs exemptions may be transferred between child care facilities in California. However, if the personal belief exemption documentation is no longer available to the new school or the new child care facility, children must meet immunization requirements to attend the new child care facility. And now I want to talk about some other provisions in SB 277, which removes immunization entry requirements for those students who are in either home-based private schools or in independent study programs and do not receive classroom-based instruction. Students in these categories still need to provide their immunization records to their schools before entry. And schools will still need to report to public health the immunization status of all students in child care, kindergarten, and 7th grade. Here's the related FAQ. What are the requirements for students entering a home-based private school or independent study program and do not receive classroom-based instruction? Students entering a home-based private school or an independent study program and do not receive classroom-based instruction are subject to immunization requirements for entry during 2015 for the year that started back in August and September, but not in 2016 or in future years. Parents or guardians must provide records to the school of any required immunizations received by these students. So this is a very similar question to the child care question asked just a short while ago. Is a personal beliefs exemption still valid if a student transfers between schools in California after 2015? Yes. Personal belief exemption filed with a school before 2016 is valid until entry into the next grade span. It was submitted during K through 6th, and it's valid from 7th through 12th. It's valid until starting 7th through 12th. And personal belief exemptions may be transferred between schools in California, both within and across school districts. However, if a personal belief exemption documentation, if the documentation is no longer available, students must meet immunization requirements or be enrolled in an independent study program and do not receive classroom-based instruction or in a home-based private school. What will happen in future years when children with a prior personal belief exemption enter their next grade span in primary or secondary school, typically either the start of transitional kindergarten or at 7th grade? Children with a valid personal beliefs exemption filed before 2016 who enter a new grade span will have to either meet all age-appropriate immunization requirements or be enrolled in an independent study program and do not receive classroom-based instruction or in a home-based private school. Specific example, what will happen with a child with a prior personal beliefs exemption in K through 6th or TK through 6th enters 7th grade? All immunization requirements for age and grade will need to be met before entering 7th grade. In order to begin 7th grade, children who had a valid PBE filed before 2016 upon entry between TK kindergarten and 6th grade need to meet all requirements for children their age, including polio, measles, rubella, chickenpox, and the primary series for diphtheria, tetanus, and pertussis, including the 7th grade requirements for Tdap and 2 doses of measles-containing vaccine. Now, I would like to briefly mention special education services, which I know is of concern to many of you listening today. The legislature, in writing SB 277, included a provision that the law does not prohibit a pupil who qualifies for individualized education program, an IEP, pursuant to federal law and Section 56026 of the State Education Code from accessing any special education and related services required by his or her individualized education program. The Shots for School website does not have additional information at this time on implementation of this provision in the law, and we'll ask you to check with your local education agency, again, legal and policy staff at your school district, or county office of education regarding implementation of this provision. If between the Department of Public Health and Department of Education and other partners we have additional clarifications on this provision, then we will add them to the information that's currently on the Shots for School website. Now, having discussed some of the aspects of SB 277, I'd like to go back to the enrollment process and describe the many aspects that are unchanged in the face of SB 277, as well as the aspects that will be different next year and beyond. An initial step will be to continue to request, review, and record immunization records from every child. California law in these aspects has not changed, and records from all students, including those in the categories of home-based school and other categories like that, will be needed for reporting and to monitor which students are unimmunized in case of disease exposures. Another aspect, the next aspect, will be, is the child being enrolled in a home-based private school or an independent study program and does not receive classroom-based instruction? If the answer is yes, the child may be admitted without meeting immunization requirements. The child's immunization records will still be recorded and incorporated into annual reporting for school. If the answer is no, that similar to ongoing practice in prior years, each requirement will need to be met either unconditionally or conditionally. Next, are all immunization requirements for the child being fulfilled unconditionally? Is there documentation for potential entrant of each required dose, either of receipt of vaccine from the yellow card or other paperwork or the immunization registry? Or is there documentation from a licensed physician of a permanent medical exemption? Or is there a valid personal belief exemption before 2016 for the current grade span that's available for the new school? And given the changes in the new law, there's only a few categories for entrance. I'm not talking about children continuing within the grade span, but for entrance, there will only be a few categories where this may apply. One category may be a child who's advancing within a district or locations between transitional kindergarten and kindergarten, where the personal belief exemption was filed before 2016 for transitional kindergarten. And another instance may be for students transferring into your school where valid documentation has been retained that entered the current grade span with a personal belief exemption. If the child has met all these requirements, the child may be admitted unconditionally into the grade span. If the child has not fulfilled all these requirements, then you need to review these requirements against criteria for conditional admission. Before talking about those conditional admission criteria one more time, I'd like to take a minute to talk some more about medical exemptions. Here's a couple more FAQs from the website. What's required for a medical exemption to a required immunization? A parent or guardian must submit a written statement from a licensed physician, an M.D. or D.O., which states that the physical condition or medical circumstances of the child are such that the required immunization is not indicated. It states which vaccines are being exempted, whether the medical exemption is permanent or temporary, and the expiration date if it is a temporary medical exemption. May other practitioners, besides licensed physicians, M.D.s and D.O.s, provide a medical exemption to a required immunization? No. Only a licensed medical doctor or doctor of osteopathic medicine may provide a medical exemption. In contrast, The other categories of licensed or credentialed practitioners in California who in 2014 and 2015 have been authorized to sign requests for personal belief exemptions, such as nurse practitioners, physician assistants, naturopathic doctors, or school nurses, may not provide medical exemptions. Are licensed physicians required to assist in requests for medical exemptions? A licensed physician may provide a medical exemption, but is not required to do so. Parents or guardians who are seeking medical exemptions and who check with schools about this question should be referred back to the physicians in advance to clarify their policies on medical exemptions. For the requirements that do not meet unconditional admission, do all remaining requirements meet criteria for conditional admission? For each remaining dose, is there documentation either of a temporary medical exemption from a licensed physician, or is there a record which documents eligibility for the conditional admission schedule? Again, have all doses that could be received, given the intervals between the doses, have all doses of vaccines which have multiple doses, have enough been given that there are no more due at the moment, but there are additional required doses due later in the year. The schedule, again, for this conditional admission eligibility and process is available through the Shots for School website. If the answer is yes, all the remaining requirements have been fulfilled, the child may be admitted conditionally, with the school reviewing records at least every 30 days thereafter until the child has met all the requirements. The school should notify parents and guardians of requirement deadlines and that the child shall be excluded after any unmet deadlines. If the answer is no, the child may not be admitted until all requirements for conditional or unconditional admission are met. One reason for talking again about conditional entrance is looking ahead as these personal belief exemptions expire in the grade span. As a child comes out of child care and the personal belief exemption is expired, if there are missing doses for multiple dose series, that child may be eligible for conditional entrance and may have to be followed as a conditional entrance until caught up. Similarly, for all the requirements under an exemption from transitional kindergarten through 6th grade that expire at the end of 6th grade and the child goes into 7th grade, some of those children may not be able to catch up right away under the schedule and so would qualify as conditional entrance and to be followed until they catch up. So now, and then lastly, as in past years, there are continue to be annual reporting requirements for all children, including those in these newly designated categories of homeschool or independent study. In closing, I just want to direct you back to the Shots for School website for existing resources, a variety of resources on general immunization requirements, as well as the new changes under SB 277, access to the language of the law itself, access to reporting login, and access to, here's the frequently asked question page again, and access to data on immunization rates by school that's posted both individually and then can be searched by a mapping function. Thank you for your attention. I want to extend my appreciation for all your unsung work in protecting the health of students, both through immunizations and many other areas of student health. Thank you again for your attention, and now back over to Catherine, our next speaker.
Wonderful. Thank you so much, Dr. Schechter. I want to tell you how much I appreciate our next speaker making herself available today. I understand you've got a very hectic day and some school issues that you need to take care of right after this call. But I want to introduce Kathy Ryan, who is the current president of the California School Nurses Organization. She has over 38 years of experience in a variety of hospital, community, and clinic settings, and she's been a school nurse for San Diego Unified School District since 2006. And Kathy, I'll hand it over to you for your presentation.
Thank you, and welcome. Thank you, everybody who's called in. This is a great turnout. I just want to go over some of the things that we as school nurses can do to support this, and also to make the process a little less painful as we deal with parents and everything who we know may be upset about it. I would suggest that, right now you start placing notices in the health office, in the main office, in the parent center, just signs that, say that there are new immunization requirements and that they're going to need to make sure that their child is up to date so that there's no surprises in the future. Start thinking about crafting in the smaller districts or even in your schools, articles for the school bulletin. At the district level, work with the public information officer and the local health officer. It would be great if the local health officer and the superintendents would draft a letter that could go out to all the parents in a district. Having a parent notification signed by the district superintendent and local health officer goes a long way to showing our partnership with the health department and letting everybody know that we're doing this together. Media releases should be going out so that people are hearing this and getting the positive spin that this is really for protecting the health of our communities, our children and our communities. So it's a concerted effort, and I'm not sure if there are on the website, are there any suggested media releases or anything, or is that something CSNO should maybe work on? So stay tuned, because if there's nothing, we will have it on our website if there's nothing that is out there yet. Make sure that your school and district websites have current active links to the Shots for School and other resources. And I would really encourage you to update the training for your support staff and the admin team so that they understand the implications of the new law. Because some of our clerical staff actually are the first people who see the students. And in some schools, they're actually doing some of the data entry even. So they need to understand this. So it's time to update training for our support staff. Health office clerks, attendance clerks, whoever does your immunization entry and review. And remind your principals and superintendents about the importance of immunizations and the new law. Refer them to the California Department of Public Health and CDE policies that are in place to protect the school community. And also talk to them about the consequences of noncompliance. There could be audits down the road, and we want to make sure that everybody is supporting this to the full extent possible, from admin on down, so that when you see a parent and you're explaining this to them and they go and talk to the principal supports what you're saying, but the principal needs to understand it to be able to support it. So it's a good time to start having those conversations now, so that everybody is on the same page, putting out the same message. And any questions that come up, feel free to contact us through the CSNO website, and we will work with the CDE and the Department of Public Health to continue to provide updates for you. Thank you. Catherine, I think I'm done.
Wonderful. Thank you so much, Kathy, for your work on this, for your partnership, and for being available to help answer questions at the end. And I am going to get to the end in a few minutes. I wanted to share some of our great resources that I know you're familiar with, some of them, and some of them may be new to you. One of our key resources that Dr. Schechter mentioned is, of course, the Shots for School website with an FAQ that I want to remind folks that this is a dynamic document, that the immunization branch is updating this as new information becomes available. We were very happy that we could provide this webinar to you today to give you some information that we've been hearing from our partners that they need to have before we start school in January and especially into spring and summer next year. So we wanted to have this webinar. We don't have all the answers yet, but they're coming, and we want to make sure you have what we have and what we can make available right now. So some of your resources, again, Shots for School, the FAQ will be updated as information is available. And if you haven't already seen this, great news that the California Immunization Handbook was recently updated as of August 2015. And so if you need to have an updated copy of that, that's available through this website as well. Of course, we always have the Centers for Disease Control and Prevention. They have amazing documents, information for parents, for healthcare providers about vaccinations and about studies and resources for parents who have questions and providers who have questions. The Immunization Action Coalition is a national organization that one of their key roles is to interpret and make the vaccine information statements, for example, available in all different languages. So this is a great resource for a number of our communities to make sure we have information in multilingual information. And again, information for health professionals, the public, and for our Immunization Coalition partners. One of my strongest resources is through the Vaccine Education Center at the Children's Hospital of Philadelphia. Many of you are familiar with Dr. Paul Offit. He leads that team, and they do a fantastic work, and they make some great resources available in great format. And I want to wind up by talking a little bit about something that Dr. Schechter had to zoom through, but the information that's available on the Shots for School website, and California is part of the big picture in the United States. And as you see from this infographic, that there's a number of states that also make their vaccine data available online, and there's a movement for other states to be able to do this, so we can have a picture of where these pockets of need are, whether it's access to immunization or pockets of folks who have vaccine concerns. Some of you are in schools that have very low exemption rates, and this is not going to impact you very much. Some of you have high exemption rates, and it's going to impact you a lot. And again, we want to be here for everyone as team vax. And we have FAQs on our website, and we wanted to call attention to one of the FAQs for physicians that, for example, the California Medical Association put together. There's the Shots for School site. The California School Board Association has a great FAQ that you might find helpful. And again, we'll be posting those on our website as they're available. And I just wanted to highlight again about the support from the California Department of Education. And now we've reached the Q&A time, and I want to say we've got a gazillion questions that have come in to answer. And if you haven't already sent your questions in, please type in the lower right-hand corner of the box. And we also polled some CSNO members prior to this webinar to get some of those questions. And I want to start with some questions about 7th graders, Dr. Schechter. We got quite a few questions asking about what happens when a 7th grader comes in and they have not received any of their vaccinations. And entwined with that is some questions about some confusion around the hepatitis B rule, because that was removed from the legislation at some point. So I was wondering if you could respond to that as far as what happens when a 7th grader appears with no vaccination record.
Thanks, Catherine. So as a child who had a valid personal belief exemption upon entry before 2016, ages out of the grade span, reaches 6th grade and goes into 7th grade, they'll be needing to fulfill the requirements for all the doses that were covered previously by the personal belief exemption. For some of those children, it may just be one dose or a few doses, so that they could be caught up fairly quickly. For some doses, I think the example you gave for a child who hadn't received any vaccines, depending on how early or late before the start of 7th grade the family starts to have the child immunized, then there's likely not going to be enough time to fully catch up, and there may only be enough time to give a first dose of each of the required vaccines to meet the requirement, in which case the child would then need to meet the qualifications for conditional admission and be followed as a conditional entrant. So some of the children whose personal belief exemptions expire may be able to switch over to unconditional admission fairly quickly, while others may be able to proceed as conditional entrants after having been partially caught up according to schedule. Questions about hepatitis B in 7th grade. One of the changes in the law over the last years struck out a 7th grade requirement for entry into 7th grade. So that is not on the list currently for vaccines required for entry into 7th grade, although it may be for transfer students entering at other grade points, and the schedule is available. The schedule, depending on age and grade, is available at Shots for School.
Excellent. And there was also a question I think you answered there about medical waivers being signed by a California M.D. D.O. And the question was about, can it be an M.D. or D.O. overseas? But we're correct that it has to be a California physician?
The law states licensed physician.
Licensed physician. Okay, so the clarification is that
if there's a question about whether the form has been signed by a licensed physician, the school can certainly be in contact with try and contact the licensed physician to complete a form or verify that it is indeed a licensed physician.
Okay, thank you. Next one's about conditional status, and I think you addressed this a little bit, Rob, but I know a lot of parents have questions about that. When, for example, with the 7th grade start, for example, we have our coalition and others have received questions from parents who are going to be immunizing, but they have concerns about having to do all of them at once. And can you speak a little bit about how the documentation works for conditional?
Sure. The documentation. So the key reference here would be the conditional admission schedule, and the full table 2 in the regulations that contains the conditional admission immunization schedule should be reviewed by the school and the family and the medical provider. The schedule approximates, but is not the same as the catch-up schedule by the ACIP or AAP or CDC. It's an approximation of that, and the student may enter once has met all the requirements that the child can receive prior to the start of school, and so depending on how many immunizations the child has had previously, whether that's none or some or next to all, and then depending on when they start catching up, that will determine how far in catch-up the child can get before the start of school and how many doses may be remaining under a conditional entrance schedule. So if a family that was starting to immunize shortly before the start of school could get maybe a first dose of everything and maybe some additional doses in depending on the timing. The deadlines would be driven, the number of shots and the deadlines would be driven by that schedule, table 2 of the regulations.
Excellent. Thank you very much. A couple questions that I'm going to go ahead and answer. One of them are regarding standardized medical exemption forms, and that came up in some of the questions that we received from the school nurses survey we did, and there's been some discussion. And you feel free to add to this if you want, Dr. Schechter, but partners are working on some recommendations around that, and we encourage you to stay tuned, and we will definitely share information as it becomes available to us. And I think that's would be a good step. And do you have anything you wanted to add, Dr. Schechter, on that?
No, we're aware that there's a request, and so I would agree with you that it's under discussion, I think, by many parties in California.
Excellent. Medical exemption need to include the medical reason for exemption.
The medical exemption may include the medical reason, but minimal elements do not. It's not required.
Right. And again, I would encourage folks to go back and listen to that webinar that we sponsored or helped produce October already, to answer any questions about medical exemption. So you will have the full picture of how that process works, and I think that'll be helpful for you too. And I would have to say we've got so many more questions coming in, and we really appreciate everyone's participation, and we will be posting these. And again, as I said before, we will be sharing all this information as it becomes available through these FAQs and on our website. And so we've reached the end of a quick hour, and we hope it's brought you up to date a little bit more than you were before on this really groundbreaking, new rule for California. We've gotten so much great feedback from other states about what California has done, and I want to thank you all for your participation, and especially to Dr. Robert Schechter and Kathy Ryan for your great presentations. And again, a big thank you to all of you. Please don't forget to complete the evaluation that will show up at the end of the broadcast, and let us know what you think about the webinar. Check the California Immunization Coalition website for future education hours on similar topics. And as I said at the beginning, or would have said at the beginning if you heard me, we will be posting this recording and the slides and PDF form on the Coalition website by next week. So thank you again for joining us, and happy holidays.